Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center, and I'm here as always with my co-host, Marta Rañón, our Executive Vice President.
Hey, Roberto.
Today we have a special guest, Sara Jacobs, founder of San Diego for Every Child, a nonprofit organization dedicated to addressing child poverty in San Diego County. Welcome, Sara.
Thank you. Thank you so much for having me.
Yes, we're really excited that you're here today, Sara, because we want to talk about family caregivers who are balancing caring for the elderly and children in their home. And, Martha and I, we had a podcast of this nature probably about a year ago or so. I can't remember exactly when. And we talked a lot about children and their role as caregivers, but it was pre-pandemic. And also one of the things that I don't recall us really engaging in, Marta, was the fact that poverty or low income or food insecurities and things of that nature actually have an impact on the household and then now the child who is also providing and helping out mom and dad with the care.
Roberto, I am so glad that we have here Sara Jacobs, because I think her insight and her experience really is going to add to this conversation. I have children and I have been a caregiver and a working professional. And during this time, it's been, of course, incredibly stressful. And we are seeing that in so many of our caregivers who are balancing work, caregiving for the elderly, caregiving for their children, house responsibilities, and it's very difficult. But like Roberto was saying, this pandemic is really, really making it clear how much of a gap there is for those who are in need. And I know in our school district alone, the school district where my children attend, there is an enormous gap and major food inequality and insecurity and health disparities. And caregivers are really bearing the brunt of this. So I really want to talk about this so that all of our caregivers who are listening out there, perhaps that there are ways that we can support them and help them, or at least connect them to vital resources.
Yes. And, Martha, the other thing that's really important is that this caregiving, children caregiving, is a much bigger issue or a much bigger concern that we should all have, because about 7% of all family caregivers, adult family caregivers, report that they have children in the home that are helping them out. And so that's about, across the country, that's about 3 to 5 million kids that are caregivers. And in San Diego County, if you take that percentage, that's about 29,000 kids in San Diego County alone that are caregivers. So it has a huge impact, and there's a lot of people. Yeah, there's a lot of people.
Yeah, and I'm so glad we're having this conversation because all of these issues really are so interlinked. And so when you take into account the kids living in poverty, the kids who are in households that are caregiving elders, and then you add the pandemic on top, I think there's a number of issues that come up. One is we know that internet connectivity in the home, enough for everyone to do what they need to do, for the parents to work, for the child to do their schooling. We know that there is also extra concerns around health when you have someone who's elderly in the home. And so now that you can't send your kid to school, you probably have more concerns about sending them to a child care center. So your options are a lot more limited. And we know that schools often are not only education centers and not only a form of childcare, but they also provide food to families. They also sometimes are families' first entry point to healthcare with the nurses and clinics that are at the schools. And so now all of a sudden you're missing those extra supports as well.
Right. And in fact, some of the roles of family caregivers, when you think of the role of a child, and we always talk about age appropriate roles for children, if they're helping with caregiving. And Martha, you talk a lot about this in a lot of your presentations that you've done.
Yes.
But the reality is that almost everything that an adult is doing to help, many children are actually in that situation as well, from the standpoint of bathing, helping with meal preparations, medications, um, lifting, transferring. So when you talk about um, that responsibility thrust upon them with all these other concerns, issues, poverty, health insecurities, food insecurities, I mean, it's just overwhelming and could become very, very problematic very quickly for an individual who's so young.
Yeah, and one of the things that I've heard talking to students is also that sometimes school or their after school programs was where they went to get away, that it was really good for their mental health to be able to have that outlet. And now, not only do they not have that, but they're often required to keep their cameras on while they're in the distance learning. And so you have that extra layer of stigma of maybe not even having your own space to be able to do the distance learning from, because you have multi generations living in a home. And so there's just a lot of components added all together, and that's, really putting a burden on our youngest San Diegans.
Sarah, to add to what you just said, and of course, as a mother who's going through distance learning with my children, I am hearing from other moms and mostly moms actually, but I'm sure other parents could relate to this, is that home is not typically where schooling happens. So it's already for a lot of younger children. There's a lot of confusion. There's a lot of level of discomfort, and then of course, I don't get it. I need help. Who's going to help? It's usually the parent, but the parent has to work, or the parent has to tend to the elderly relative or the friend or whoever it is that they're caring for. So children are really experiencing hyper anxiety, and that's also not good for mental well being. And I know here at SERC, we do a lot to talk about self care and incorporate some tools for the adults who are usually the caregivers. But I wonder if you can also talk to that need for mental health support for children.
Oh, absolutely. This is so critical. And part of the work of San Diego for Every Child, we are co chairing a task force on equitable distance learning across San Diego County. And a big thing that we are including is that actually we need to make sure that teachers or child care providers or parents, whoever's watching the kids, are getting the social and emotional training that they need to be able to help the children through this difficult time. Because it's absolutely true that children are experiencing this moment very differently than adults are. And there's a lot of mental health concerns there. And so we want to make sure that every adult that is interacting with these children has the socio-emotional training that they need to do that in the most effective way.
Yeah, and Sarah, and I would just add to this is that when we're also talking about low income, poverty, stricken families, we're also looking at, and you're talking, Martha, about you know the the parent having to help with the child with the internet connection and this and that and so forth. However, in many of these households, both parents are actually out of the house working, and the kid is
Mm-hmm.
sometimes having to maneuver and deal with the care, with the internet, with the school, while helping grandma get up from her wheelchair to go sit on the couch, and
Yes.
maybe make lunch for everybody. So that whole level of support in the home, or like you said, Sarah, out at school with the counselor or the school teacher or other kids, socialization, that might not be existent, and it compounds everything.
And additionally, we haven't yet talked about language barriers, but this is all assuming that the parent is given information from their school in a language that they understand. Parent Institute for Quality Education did a survey of the parents they work with, and a third of them don't have email addresses, which we know is the main way that schools are communicating. And so, there's this extra layer, especially for some of these families, where the kid is now also having to take on this extra adult role of translating what's happening in addition to everything else that we're talking about.
I can completely relate to that. As a young kid, I was often in that role as translator for my parents of important information, whether it was legal or health or insurance or whatever it was. And that is also what we are seeing with children who are having to take those adult roles. And what I really find interesting is that in the organization that you are working with, San Diego for Every Child, that you take a very holistic approach to helping children. It's not only poverty in the home, but also quality education, unemployment, health, assistance, obviously with resources. And I think that is wonderful. I really commend your efforts on doing that. And I'm wondering if this is something that you are planning to obviously not only implement in San Diego County, but maybe there is a broader goal, because once the pandemic is over, these issues will still be there. These children will still be faced with those challenges, and these families are still, even more so if some of them have lost their jobs, are going to have these same challenges. So I wonder, I'm curious to hear from you, Sara, if there are any plans to kind of expand on this model.
It's a really great question, and we actually founded the organization. We started in 2018, and our goal was to cut in half the experience of childhood poverty in San Diego over the next 10 years. And we define the experience of poverty, and we're very intentional about using that language because it's not just about the income, right? It's about making sure every child has stable housing, every child has nutritious food, every child has somewhere where they are safe and cared for, and every child has that quality early care and education. And so, for us, we defined the experience of poverty that way, and we were really working towards how can we create a better safety net so that regardless of the income of the family, every child in San Diego could have their needs met. Now, then COVID happened, and obviously that really changes the landscape of this, because we know even before the crisis, we had about 40% of our kids who were experiencing at least one form of this poverty, and now it's a lot more. And when schools were closing, we immediately convened conversations to identify the three key needs of children during this time, which was a safe place to be, so childcare, especially for essential workers, equitable distance learning, and food security. We are now working on transitioning into a longer term plan. As you mentioned, these issues don't go away, and we know that this crisis is not, it's acute and long term at the same time, right? We're going to be living in some sort of COVID world for a while. And so how do we take the lessons we learned from some of this emergency response and build it into a broader coalition and focus on some of the advocacy we know is going to need to happen in order to address these problems in a more long-term way? And so we're continuing that, and we are hoping that the models and the collaborative approach and the way we're working can be things that are used in other areas and can be scaled to other places, because we really think that more gets done when we can do it in this collaborative way and where we're bringing everyone together and pulling in a common direction.
And I commend you also, Sara, for your work, because, addressing basic needs for any individual is extremely important. I mean, I know from our experience, Martha, you can, share any stories you have, but, families who are caregivers, even if the service is great, even if we have support for them, if they're struggling to pay the rent, if they're struggling to find food, if they need money for medications, they don't have time to work on themselves or develop a great comprehensive plan that will help their caregiving situation, because their basic needs are not being met. So I commend
survival.
you for the work. It's survival, absolutely. And the truth is that, these, I love the fact that you have, a 10-year goal to cut it poverty and improves situation for children, because caregiving is not going to go away either. And in fact, in 2015, I think the data, some national surveys showed that approximately about 1 million, and they feel it was underreported, were children that were caregivers in 2015. 2020, it's anywhere between 3.5 to 5.5 million. And the number of family caregivers is going to increase. And the number of people needing help is going to increase. And parents have to rely on their family. Families have to rely on their family, and multi-generational households are very common. They're becoming more common as things get so expensive, and so this is not going away. So definitely addressing those types of needs. I know that as a parent. When I was a caregiver, my parents were already older, so I didn't experience, the youth caregiver dynamic. But I know that parents often feel really grateful that their kids are helping them, and at the same time feel really guilty, and because they're having to have their children help in a situation where they shouldn't maybe be helping, but it's there and it's a reality, and it's going to continue to grow. One thing I wanted to just touch base on during this conversation is, we talked about some of the roles of caregivers, some of the challenges with poverty that children and their families will face, especially when they're dealing with caregiving. When we're looking at these types of situations and we know that the child is starting to have some issues or problems, I mean, what is it that we can do to help that child as adults, or what can parents do? And I know that one of them is having honest conversations about their feelings and why they're feeling certain ways. Martha, you do presentations all the time about, be in tune with what's happening with your children, and ask them questions, and, age appropriate types of responsibility. But there's also warning signs that we might want to be considering. And Sarah, you might, chime in on any of these. For example, if the kid is starting to have homework problems, or their grades are dropping, or they're having trouble with sleeping or eating problems, those are maybe some warning signs that there's a lot happening here. They maybe need to have that conversation.
That's absolutely right. Those are the warning signs. And, there's a lot of resources out there that you can get help. The school often has resources depending what school district that you're in. And it is really important because, as you were saying, this number is only going to increase. I'm a millennial, and they call us the sandwich generation. We will be right there having young kids and aging parents at the same time. And so I'm really hopeful, because I feel like a lot of the work you all are doing is going to make it so that as the problem grows, there are these support systems, there are these resources available, so that people don't have to go through it alone, and that they really are able to get the help that they need. From San Diego For Every Child's perspective, we do have a micro grant program. So if you're a family who needs to have subsidized childcare for your child, or just a little help buying some food or cleaning supplies or diapers, you can go to sandiegoforeverychild.org/COVID-19 and apply there. And if you are a family care provider that has multiple children in the home that you're caring for, you can also apply to the San Diego Foundation, a program now for child care providers, to help them get the cleaning supplies that they need.
Those are wonderful resources, Sarah. Thank you so much for sharing that. I'm sure that, we talk about this statistic in San Diego County that the caregiver, the face of the caregiver is changing. And we are seeing the younger caregiver, a 49-year-old working at least 20 hours outside the home. Of course, that was before COVID. Now they're working 20 hours in the home while caring for elderly individuals and their children. So yes, absolutely, that sandwich generation, that's going to be the case for many, many years. And we want to make sure that people out there know they don't have to do caregiving alone. We are here to help, and collaborating with you and your organization are prime examples of how we can help each other, especially during this crisis.
Yes, Marta, and I concur, and I want to remind people that one of the important things that you just mentioned, Sarah, is resources, accessing resources, and by connecting with Southern Caregiver Resource Centers, families who are in these caregiver situations could get connected to a professional, a family clinician, a family consultant that can help assess their needs and help them develop these care plans, and really help them address and maybe help them even set boundaries, which is really hard to do right now. I mean, there are no boundaries, everything's blurred.
Very hard.
But even with that, have guidance related to boundaries, and that could help their caregiving situation, as well as with their children who are helping them with their caregiving situation. Well, that's all the time we have left for this edition of Let's Talk Caregiving. I want to thank Martha for co-hosting another important and stimulating discussion, and our guest, Sara Jacobs. I want to remind our audience that if you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's actually a sign of strength. Just go to our website at scrc.care or call us at 1-800-827-1008. All our programs and services are currently available through virtual platforms. Follow us on Facebook for more podcasts. Also, SCRC is a nonprofit organization, and we provide our services due to the generosity of our donors and community partners. If you want to make a tax-deductible donation, please go to our website and click on the Donate tab. And remember, SCRC is here for you,
caring for those who care for others.
Thank you.